Now, as we talk about eruption, a horse has baby teeth or deciduate teeth. These teeth are the incisors and the 3 premolars. So we have caps or baby teeth over each one of these permanent teeth. As these are shed, they are pushed out, as well as the nerve supply and the blood supply is cut off to them, and that's how the permanent tooth is erupted underneath. As that happens, then we have the shedding of caps, which takes place between his 2 and his 3-year-old year. Whenever we do that, we need to be conscientious of not allowing these caps to become trapped. The ones that are most commonly trapped is premolar 4, and the reason is that the molar erupts, this premolar permanent erupts, trapping the cap or the baby tooth between the two. Consequently, we end up with an abscess or a swelling on the jaw, either on the upper or on the lower arcade, and we see those as bumps under the chin. Further, let's distinguish what is a wave mouth and or a shear mouth. A wave mouth is when this horse has a pattern like this horse does, in the fact that it is not smooth and level throughout the mouth, and it has a inconsistency or a wave pattern to the arcade. You can see, I think, that this tooth is extremely tall when it is compared to its counterpart here at the back. That is considered a wave mouth. A shear mouth, in contrast to that, would be when this arcade is so sharply demarcated, meaning that this tooth nearly starts at the base of the skull here, but on the buccal side is very tall. Then in turn we consider that to be a shear mouthed horse, because he no longer can, in his normal chewing pattern, chew in a circular fashion, because as a horse would normally chew, he chews in a round and round forward type of chewing pattern. If you look at him from the bottom, then you can see relatively easy that his bottom jaw is much narrower than what his top jaw is. So his top teeth do not touch all the way across. As he's chewing from side to side in that circular pattern, he does not wear off the outside edge, leaving points. We stole a term from the brick masons that we refer to as floating. Although floating is important as we define floating, then, as we're coming across this arcade and we are leveling the arcade, that is important because we take this surface and instead of having this wave, we level out portions of this wave. Although we concentrate mainly on the outside edge of the tooth and not upon the occlusal surface or the grinding surface of the tooth, just the outside edge. With that in mind, what we're doing that is different with comprehensive dentistry is not just moving a rasp over the entire arcade and floating it. Further, we're actually reaching around and altering the architecture of this tooth throughout approximately 1/8 to 1/4 of an inch. This is done so that as this horse erupts this tooth, which he is in a continuous erupter, his tooth grows at approximately 1/4 of an inch per year. So we roll this edge and sculpt this tooth, if you will, so that as it continues to erupt, that it doesn't reproduce this point within a short amount of time. That is why we can now make dentistry last longer than 35 to 40 days. And we can actually make a horse comfortable for 6 to 9 months, up to a year. Although there is no dentistry that is going to last longer than a year, in my opinion, because the cheek and the gum coerce down to about approximately half that distance. So if we have cheek to here, and we can only reach approximately 1/4 of an inch up this direction, and his tooth grows 1/4 of an inch each year, the dentistry that we did last year is now gone this year. Lateral excursion is the last thing we'll try to touch on, and that is the amount of movement that the horse has from side to side before he contacts his cheek teeth and forces his jaw apart. As he comes on apart, you can see that his teeth begin to gap on the front. Whenever he's in the middle, they touch. As he moves out, he starts to gap. That amount of movement is termed lateral excursion. We use that term to know how well we have an occlusal surface. Other things that we could possibly touch on that would maybe help us would be things like TMJ, meaning temporal mandibular joint, and the pain that is associated with it from having an abnormal bite. We could talk about parrot mouth, which means that the horse has an overbite. We could talk about periodontal cavities, where you can see on this horse he has a cavity in this tooth. I'll turn his skull up just a little, and you can see the black spot right here. That is a cavity in the tooth, and he has a periodontal pocket right here. You can see how the tooth has eroded away and the bone is malformed in this area due to food packing in and around the root of that tooth. So periodontal pocketing, lateral excursion, deciduate teeth or caps, caudal, rostral, points, hooks, either at the back or at the front, lingual, next to the tongue, buccal on the outside, shear, meaning that his mouth is sheer in the way that his teeth have erupted and he's got a sharp point to the inside, wave, meaning that the arcade has an abnormal appearance to it when viewed from the side. Blind wolf teeth we did not touch, although we know that the wolf teeth usually are on just the uppers, although we have seen wolf teeth on the lowers. But a blind wolf tooth would be one that was covered by the skin yet, or the mucosa, and had not erupted through. And those seem to be more painful and cause the horse more problems than a fully erupted wolf tooth would. Canines, again, are the ones that are here, and a wolf tooth would be here. Okay, so now that we have an understanding of dental anatomy, let's go look at the horse and let's do a dental procedure, and let's show you how the dental procedure is done and why the instrumentation of today outweighs and maybe relics some of the instrumentation that we used to work with.